Good afternoon, everybody. Happy Wednesday. It's Dr. Galvin with another update on this current situation with COVID. We're going to do things a little bit differently today. I'm going to actually talk about, I'm going to go a little bit of overview of the vaccine, how it works, and also I'm going to, kind of directly address some of these anti-vaccine people that are making all these spurious claims with no data to back them up about, you shouldn't get vaccinated. And I want to give you some tools in case you've got a family member or a loved one that is on the fence about getting vaccinated. Maybe you can give them some good information. I'm Dr. Jeffrey Galvin. I'm a board-certified emergency medicine and functional medicine, precision medicine physician outside of Charlotte. I've been working in the emergency department during the whole COVID outbreak, and also have been posting these videos for some time. So I've got a little bit of experience. I've seen many, I've taken care of hundreds of COVID patients, and now in our clinic, we're actually starting to take care of many people with long-term, long COVID, those symptoms that people get well after, months and months after they've been sick. First off, why do we need to worry? Like, is it such a big deal? Well, we've almost 550,000 deaths from COVID last year. It made COVID the number 3 cause of death in the US for 2020, behind heart disease and cancer. So it's a huge number of people that lost their lives because of this. The CDC has gone back and analyzed this data, and about 97% of those reported deaths also had, COVID common things. They died of pneumonia, respiratory failure, all the things that you expect people to get to with COVID. So, they're not spurious deaths that are caused by something else. They were caused by COVID. If not for COVID, these people would be alive. 574 million doses worldwide, 150 million in the US, no problems. How do these, we primarily are using Pfizer and Moderna, and those are mRNA vaccines. And so let me give you a really quick summary of how I explain people how they work. Your DNA is like a cookbook, okay? And that cookbook is filled with millions of recipes, and each one of those recipes is a protein that we need. And those proteins are made, and they basically perform all the functions, structures, everything else we need are built from these basic protein building blocks. And so it's a cookbook, and it lives in the nucleus of the cell. Now, let's use this cookbook analogy, and let's say that we want to make veal cacciatore, okay? And so the nucleus says we need to make veal cacciatore, so we need to send the recipe out. And so an enzyme goes and it looks through the DNA cookbook to the page that recipe is on, and it tells the DNA at that point, let's open up, okay? So now that page is open with the instructions written there. Then what's called messenger RNA comes. It's a piece of a small piece of protein, comes and it makes a copy of the recipe. It doesn't change the recipe, it just makes a copy of it. And then it leaves, that DNA closes back up, and that messenger RNA leaves the nucleus where the DNA lives, and it goes out into the cytoplasm of the cell to this place called ribosomes. And ribosomes are basically little protein factories, but for our analogy, it's the kitchen, okay? And that messenger RNA goes into the kitchen and it hands this recipe for veal cacciatore to the chef. And the chef looks at it and goes, okay, this is what we're gonna make. And they just start making veal cacciatore. Now, so in this case, the recipe is for the spike protein of COVID, of the SARS-CoV-2 virus. And the cells just start producing just that spike protein, not the whole virus, just that little protein that the virus needs to stick to the cell. It's a foreign protein. So that cell starts spitting out these copies of the spike protein. Your immune system recognizes it as a foreign protein, and you develop an immune response. Now, the way the immune system works is that the first time it gets exposed to something, it gets, it has a little bit of response and it gets a little leery. It's a little bit like, you've got your Nest doorbell cam and some suspicious guy walks up and you see it, and then you're a little bit hyper vigilant. You're like looking, whenever that little alert goes up, you're checking to see if that guy's back. And if he comes back, you're on the phone to call the police right away, right? Well, the same thing. So we give that initial dose of vaccine, we sort of prime the immune system, and then 3-4 weeks later, you get the second one and you get a much more robust immune response. And that's why people get like chills and body aches a lot of times with that second dose of vaccine, or if you've had COVID with the first dose of vaccine. Okay, so that's what happens. Now that recipe that the cook in the ribosomes is making is short-lived. It only lasts by the time they use it a number of times, it gets frayed and dirty and it disappears. And so that messenger RNA is only there, present, for less than 24 hours typically, and then it's gone. And then the cell makes the next, the cells are sending out recipes all the time, and then it's going to make, a hamburger or whatever the next recipe is. So it doesn't stick around at all. And that's essentially how these vaccines work. And they're very, very effective, surprisingly effective, more effective than really almost any vaccine we've had. And the fact is, it's not new technology. We've been working on mRNA technology for 50 years, and it just so happens that about 2 or 3 years ago, they finally overcame some of the major hurdles to utilizing these things to make medicines, and it was easy to convert it over to make vaccines. As a matter of fact, once the virus was genotyped, they were able to make a first preliminary prototype vaccine within a few weeks. So, and that bodes well if we ever have another pandemic, which we probably will, then we will be able to make these vaccines much more quicker next time. So let's get to sort of these anti-vaccine claims. We already talked a little bit about like the numbers aren't real. Well, the numbers are real. I mean, the statistics and things, show out, clearly show. And I can tell you from working in the emergency department, they're real. They are. One of the claims you hear is that people will say, well, I don't need to worry about it because COVID's no worse than the flu. Well, that's patently untrue. The COVID has killed more people in a year than we've lost to the flu in the last 5 or 6 years together. So it's far more deadly. Not only that, but it's far more contagious. And people that have the flu are contagious when they're actually sick. So when you're sick with the flu, you're contagious. You're contagious with COVID, a week before with no symptoms. So you can spread it all over the place. And there's a high percentage of people that end up with, with longer term symptoms that you never see with influenza. But we have, there may be 20, 30% of people that develop COVID that have persistent symptoms for months and months afterwards. My daughter had resting tachycardias for 2 months after she had COVID, and she's a healthy 21-year-old, and she had very minimal COVID symptoms when she was sick. And we're seeing lots and lots of that brain fog and all kinds of things that we're working with in the clinic. The next thing you'll hear is that, when they try to make a vaccine for the original SARS, the vaccine actually caused this thing called antibody-dependent enhancement, which killed all the animals that they tested it on. And indeed, that happened. It was a different type of vaccine than the mRNA, and the mRNAs have never been shown to do that. But when that happened, the scientists quickly figured out what the problem was. They make a little tweak to the RNA sequence of a traditional vaccine, and it doesn't happen. And we've given, 574 million doses. How many cases of antibody-dependent enhancement have we seen related to COVID vaccines? 0. Show me one. If you're anti-vax people, please show us a single case of it. Not happening because we know how to fix that and not let it happen now. The next one is that the claim that the vaccines change your DNA. Well, I just explained what happened, right? And so that vaccine that we're giving essentially is that recipe, right? And instead of the recipe coming from the nucleus, it's coming from outside, and we're injecting it into, and it goes into the cell. It never goes to the nucleus where the DNA lives. Messenger RNA does not change DNA at all. It doesn't have the capacity to do that. But not only that, the vaccine never goes near the DNA. It goes directly to the ribosomes, and we're giving that recipe. Basically, it's almost like we're ordering takeout. Instead of like ordering from the waiter in the nucleus, we're actually calling in the order, and we're sending it from outside. And so it does not change your DNA. And that messenger RNA sequence degrades very quickly, and it's quickly gone within a day or so. The next claim is there's been this wave of suspicious deaths since COVID, since the vaccination started. Again, not true. We certainly haven't seen anything in the emergency department. But also, if you look, there's a thing called the VAERS database, and you can search it, and that's a database where people report things if they happen like weird around time of vaccination. So if any weirdness occurs, then you can make this report to the VAERS database, and it's pretty detailed. I'll tell you how old the person was, what kind of medical problems. It's interesting if you want to look at it. There's been about 1,000 deaths reported to the VAERS database so far that have happened within a couple weeks or so of vaccination. Now, coincidentally, we're going to have multiple. People just by chance are going to die of different things, and the vaccine is unrelated. However, let's just, for the sake of argument, say that all 1,000 people that are reported there actually were killed by the vaccine. What would that percentage be? Well, if you take 1,000 deaths and you divide it by 150 million doses given, that gives you 0.0000067%. So absolutely minuscule number. And when you look through that VAERS database, what do most of the case reports say? 90-year-old in hospice, went to bed, didn't wake up the next morning. Well, guess what? Those people in that situation pass away all the time. It was probably just a coincidence. They've been looking at these cases and they have not been able to find any kind of link. So I think that the vaccine has been well proven to be safe and it's been well proven to be effective. And so hopefully that will give you some information that you can share with your friends and family if you're concerned about them. We need to get a good percentage of the population immunized to get through this. Now, luckily, those numbers of vaccine hesitant people are plummeting, because you know what? People are seeing that, if I'm vaccinated, I can do all this other stuff and not worry about it. And not only that, but all my friends who have gotten vaccinated and family members, they're fine. And remember, who have we vaccinated so far? We vaccinated the sickest people in the country, the elderly, the chronically ill, and plus all of our healthcare providers. And so if we're going to have problems, that sick proportion of people is going to be it. And, in terms of, we've talked a little bit about before of healthcare providers being hesitant. And I explained, I think in a video last week or the week before, that really when you dig down to it, it's something like 93% of physicians that are actually seeing patients have gotten vaccinated. Because they understand, and that many of the people who are vaccine hesitant that are classified as healthcare are people who are really uneducated. They're people who are really have a low level of education, but they work in healthcare. They might be a nursing assistant or a phlebotomist or something like that. And again, education is what's going to get people on board and understanding. And hopefully that this is a little bit of education for folks, and hopefully you can use this to spread good information, not bad information, to your friends and family, and to our anti-vax people who continuously bombard me with stuff. Again, please provide data. I don't want an op-ed. I don't want some crazy YouTube video. Show me some papers that prove your point. Otherwise, get out of my face, okay? Anyway, everybody have a great day. Stay safe. Wear masks. Wash your hands, look out for yourselves, look out for those around you, and look out for your families. I'll talk to you soon.